Welcome to the MS&Me Radio Network. The broadcast shows are for informational and entertainment purposes only. They are not designed to provide listeners with specific personal, medical, or counseling advice. Individuals with a medical issue should always consult their healthcare provider. MS&Me is not responsible for content of individual shows. The views expressed by show hosts or their guests are their own. Enjoy the show.
I'm John Strum, and this is RealTalk MS. It's October 16th, and we have a lot to talk about. I'm back from Berlin, Germany, where I attended the 34th annual ECTRIMS Congress. The European Conference for Treatment and Research in Multiple Sclerosis hosts the largest MS conference in the world. And honestly, it felt like the largest MS conference in the world. The single biggest challenge that I faced during the 3-day conference was trying to decide which sessions I wanted to attend. With over 80 live presentations, more than 1,000 poster presentations, and any number of meetings and even casual conversations that seemed to pop up everywhere. It's challenging trying to take it all in. Because I've decided you really can't. But I spent every day at ECTRIMS doing my very best to find my way into as many presentations as I possibly could. And I appreciate all of you who listened to the podcast episodes that I was able to record from ECTRIMS. I haven't had a chance to get too deep into the episode statistics, but I know that thousands of you listened, and a lot of you emailed or messaged me, and as always, I really appreciate all of your feedback. And although ECTRIMS has ended, there's still a bit more to report from the conference, so I guess we can consider this podcast episode as the ECTRIMS wrap-up. Cannabidiol was part of the conversation at ECTRIMS last week. Data from 2 different clinical trials showed that Sativex, a cannabidiol spray, showed some effectiveness in treating moderate to severe spasticity among MS patients who had failed to benefit from other spasticity treatments. One of the clinical trials is still ongoing in Italy, and it involves 1,650 patients being treated at 30 different MS centers, and people living with progressive MS made up about 80% of this patient group. And while the data is still considered preliminary, it showed that after 1 month of using Sativex, which is sprayed and absorbed through the lining of the mouth, 1,432 patients showed a very moderate level of improvement in their level of spasticity. Another 405 patients showed a slightly higher level of improvement. Well, during this clinical trial and another trial that had already concluded in Czechoslovakia, Sativex was shown to be safe. It had no negative impact in either study. And while positive news can always be considered to be good news, there were some questions raised as to whether a slight improvement in spasticity was moving the needle enough for people who were living with severe spasticity as one of their MS symptoms. I think that question is probably still open for future discussion. Sativex has already been approved for use in Europe and Israel, but hasn't yet received FDA approval in the United States. One of the very popular presentations at ECTRIMS was actually a whole series of presentations on the impact of environmental factors on MS. As a matter of fact, by the time that I arrived at this presentation, the very large auditorium was completely full. So I joined a crowd watching a TV monitor that was set up in the hallway just to handle the obvious overflow. During presentations by Professor Ali Manichurinia of the Karolinska Institute of Sweden and Professor Ralph Linker of Friedrich Alexander University and others, it was pointed out that when we look at the impact of environment on MS, we actually have to take 2 environments into account: the environment in which we live and the environment which we create through our diet and other lifestyle choices. In fact, the impact of lifestyle choices was certainly one of the themes that kept popping up at ECTRIMS. Some of the presentations on lifestyle choices reinforced information that was already known. Smoking makes MS worse. Obesity makes MS worse. There was a strong case made that salt plays a role in MS, and salt may impact the gut microbiome, which may impact MS. The conversation about environmental factors and lifestyle choices is becoming more and more pronounced, and I expect that we'll see research become more and more focused in better understanding how all of these factors impact multiple sclerosis. But for now, the takeaway seems to be that all other things being equal, making healthy lifestyle choices is always a good idea, and perhaps an especially good idea if you're living with a chronic progressive illness like multiple sclerosis. If you're a regular listener to the podcast, then you might remember that just a few weeks ago we discussed something called neurofilament light chain. Neurofilament light chain is a protein, and evidence shows that the levels of neurofilament light chain are increased in the blood and cerebrospinal fluid of patients with MS. Now, neurofilament light chain is usually only found in nerve cells, but as MS causes the progressive degeneration of our nerve cells, this neurofilament light chain is released into the blood and cerebrospinal fluid. So the idea that neurofilament light chain can serve as a biomarker for MS progression is an idea that's gaining interest and momentum in the research community. And just to review, a biomarker is a measurable characteristic in our bodies whose presence indicates that something is taking place. That something might be disease or infection. For instance, when your doctor gives you a simple blood test and finds that your white cell count is elevated, well, that elevated white cell count is a biomarker of infection. So biomarkers that detect MS early and can help neurologists accurately predict disease progression, well, that's a major area of interest in MS research. At ECTRIMS, Dr. Peter Calabrese from Johns Hopkins Hospital in Baltimore presented the results of a data analysis that demonstrated that people living with relapsing remitting MS who had neurofilament light chain levels that were higher than a proposed threshold had a higher risk of disease activity and increased disability, lesions, and brain atrophy in the long term. So, among people living with relapsing remitting multiple sclerosis, neurofilament light chain levels correlate with disease activities. They can help predict clinical outcomes, and they're even reduced when that patient is on disease-modifying treatment. But in order for neurofilament light chain to be integrated into clinical practice, that is, to make it really useful when you visit your neurologist for an appointment, well, we still need to understand where the cutoff points are. In other words, when does neurofilament light chain reach a certain level that indicates disease progression or worsening disability? Well, the data presented by Dr. Calabrese and his team suggested where those cutoff points should be. So we're going to continue to watch this topic as research continues to define how neurofilament light chain can serve as a meaningful clinical measure and tool and a reliable biomarker for MS progression. But we're kind of observing in real time how something goes from being a concept into something that's practical and useful in clinical practice. While I was at ECTRIMS, I sat down with Bruce Bebo, the Executive Vice President of Research at the National MS Society, and Bruce shared his perspective on some of the presentations that had caught his attention during the conference. We also talked about the $12 million research investment that the MS Society had just announced, and we had such a good conversation, such an informative conversation, that I wanted to include it in today's ECTRIMS wrap-up. So in a moment, you'll hear my conversation at ECTRIMS with Bruce Bebo. Well, I'm sitting comfortably on a set of steps right outside the CityCube Conference Center in Berlin, talking with the Executive Vice President of Research for the National MS Society, Bruce Bebo. Needless to say, he's quite involved in a lot of what's being discussed at ECTRIMS this year. So, Bruce, what have you seen and heard that's particularly stood out to you?
Well, it's nice to be sitting on the steps with you, John, and to be outside in the fresh air, which doesn't happen very often at this meeting. ECTRIMS is the largest meeting that's focused completely on MS, and there are about 10,000 MS researchers here for these 3 days in Berlin at the CityCube here in Berlin that are all reporting the latest findings from their laboratories and their clinics of what they've been studying in MS. And so it varies across the board from some very basic research about the fundamental pathways that lead to damage that causes MS to information about the latest treatments and how one goes about treating MS and how one goes about helping people with MS live their best lives through wellness and lifestyle and rehabilitation and exercise. So it really runs a whole spectrum from very basic science down to cells and molecules up to populations of people living with MS and trying to learn from populations. I just came out of a session that was doing more of that population research. So what can we learn from looking at large numbers of MS, people living with MS, about triggers for disease and how MS progresses and how we might learn from studying large groups of people living with MS about ways we could slow down or stop progression. So a couple interesting presentations I just saw. One, maybe your listeners remember this excitement about salt a few years ago, and some studies and models of MS that showed that salt could enhance immune responses that damaged myelin and led to demyelination and disability in animals. And so people, since that made that really interesting observation, been trying to find what the connection is in people living with MS. And it was a very interesting presentation. Salt and sodium is really hard to measure in humans. It fluctuates during the course of the day, and it's hard to get a good measurement on it. This investigator used a scanner on your skin that could measure essentially the color of your skin that varies depending on salt concentration, and could get a good measurement of salt, and subsequently was able to correlate some aspects of disease of MS with salt concentration, sort of reviving this salt story a little bit that hadn't really had a lot of follow-up since some of the animal studies. So I thought that was interesting. Another study I just saw from Johns Hopkins looking at the connection between obesity and brain volume. So we think that the volume of the gray matter in the central nervous system is a good measurement of disability progression. And we also know that obesity is a risk factor for developing MS, and learning more that obesity, and it could be also a risk factor for accelerating progression. And so this investigator showed really compelling data that the higher your BMI, your body mass index, the faster your gray matter or the cells in your nervous system were deteriorating. And so it just sort of emphasizes, I think, the growing awareness that being healthy, including having a healthy weight and eating a healthy diet and having healthy habits, can have great effects on reducing the sort of pathway to progression, reducing the rate at which disability progresses. And likewise, being unhealthy, having an unhealthy weight, having unhealthy habits can accelerate progression. So there are many more presentations like that where we're learning more and more about what people with MS can do now to slow down, or perhaps, I said the word earlier today, imperceptibly progress, really slow down the rate to the point where you might have trouble noticing it. There's another thing related to the salt story that was really interesting was that some of the immunological markers that showed heightened inflammation in people that had higher salt intake could be reduced by taking a probiotic. And so this link between diet and what we eat, and in this case salt, and gut microbiome and actual interventions to turn that around is also the topic of conversation here.
I think that's really, really interesting, because I think for an awful lot of people who are living with MS, they think that once they're on a disease-modifying therapy, their work is done. As long as they stay on their treatment, it's what they should be doing. But in fact, you can be making just healthy lifestyle choices that are absolutely going to impact how your disease progression is likely to occur.
Yeah, that's exactly right. And I think what's maybe even layered on top of that is we're learning that comorbidities, which is defined as other diseases that live on top of or in parallel with MS, can also promote or exacerbate or accelerate progression. So anything that a person can do to reduce their risk for cardiovascular disease, reduce their risk for hypertension or high blood pressure, can reduce the risk for type 1 diabetes, are going to slow down or prevent, the very least, the accelerated progression that happens when you layer those other health conditions on top of that. And I think that's one of the main inspirations people should have for trying to change their lifestyle and living a more healthy lifestyle, is that prevention of comorbid conditions that can accelerate progression.
Well, I just think that's really good news. As I said, I think it actually empowers people who are living with MS to be active participants in their treatment instead of being more of a passive patient, if you will. And that's great. One of the other things that happened right before ECTRIMS got started was the National MS Society made a pretty exciting announcement in terms of added research funding. I've talked in previous podcast episodes how the National MS Society is the largest private funder of MS research in the world, and having already raised, or I should say not raised, but donated over $1 billion toward MS research. I guess the latest is a $12 million investment in committing to 40 different research projects. Can you talk a little bit about that?
Sure. So I would use the word invested instead of donated, because we are investing in research that's leading to breakthroughs in our understanding of MS. And the fundamental research, John, you mentioned this $1 billion that we've invested, has led the fundamental research and discoveries that have been made with those investments have absolutely laid the groundwork for all of the disease-modifying treatments that we have in relapsing MS, and now, for the first time, that we also have in progressive MS. So I'm very proud of the Society's role in that, and the continuing role in catalyzing more research that's going to lead to better understandings of MS and the next generation of treatments, which undoubtedly will be more effective and hopefully come with fewer side effects and risks. So we've talked about before, we have a very rigorous process by which we evaluate opportunities to fund research. We receive over 600 applications a year from scientists around the world with their best ideas about MS research and ideas for understanding MS and treating MS better. And we assemble a group of hundreds of expert volunteers to help us evaluate the technical scientific merit of those applications, and then also assemble a committee of experts and also people living with MS to help us prioritize the best research to fund out of that pool. And we come up with this 40 projects or so to add to the portfolio that already exists, which is over 300 projects. And John, right now, at this moment, we have about $80 million in current commitments that we've made to research, funding, again, over 300 projects spanning the spectrum from very basic science, trying to understand and answer some fundamental, still unanswered questions in MS, all the way to doing translational research of potential treatments that don't have other funding sources because they're not necessarily commercially interesting, let's say, to a pharmaceutical company or a biotech company, because there may not be intellectual property or patent protection, but they could still be valuable treatments for MS. That's our sweet spot when it comes to translational and clinical research. An example of which is we're funding a trial called MS-STAT2. This is testing the possibility that a statin called simvastatin can slow down progressive MS. We helped fund an earlier phase 2 study that showed that people taking this high doses of statin, their brain volume rate was reduced, so they lost less brain volume than the folks that were in the control arm of the study, suggesting that this could be a very interesting potential treatment for progressive MS. But no drug company is going to take this project on because statins are generic, they're inexpensive, there's no commercial incentive. But that's where the society steps in, and that's our sweet spot. And not just the society, but we collaborated with the UK MS Society and with the British government to fund together a clinical study to test whether statins could reduce progressive MS. So we go from very basic science about cells and pathways and molecular targets to try to understand the disease better, all the way to translational research and clinical trials. Again, not trying to do what pharmaceutical companies already do well, but finding that niche where their resources are required to push an interesting drug into potentially to treatments for people living with MS.
So I think there's two really interesting takeaways from what you just told me. One is that the society is looking to fund the best research regardless of its commercial appeal, which is so important, and regardless of where it comes from. You mentioned that your applications come from all over the world. So although the society is US based, as you just mentioned, you're collaborating with the UK on a project and you're looking at other projects. So you don't necessarily limit where the best solutions could potentially come from.
Yeah, I mean, people with MS don't care where the cure for MS comes from. They only care that we get to better treatments and a cure for MS as fast as we possibly can. And that's what drives us. People with MS are at the center of how we make decisions about where we apply our resources in all aspects of our work, and especially in research. And people don't care where the cure comes from. So neither do we.
No, but I guarantee you, people do care to hear this kind of encouraging news, and I'm glad there's so much of it for us to share today. Bruce Bebo, thank you for taking the time to talk with me.
Thanks, John. It's always a pleasure.
That's going to wrap up this episode of Real Talk MS. Don't forget to visit the Apple App Store or the Google Play Store and download the Real Talk MS app to your iPhone, iPad, Android smartphone, or tablet. It's the easiest way for you to connect to the podcast, and it's a great way for me to share all sorts of bonus content with you in the weeks and months ahead. I started experimenting with that bonus content while I was at ECTRIMS, and you can look forward to more as we move forward. Speaking of moving forward, next week, you can look forward to a special announcement on Real Talk MS, and it's one that I hope you're going to find pretty interesting. My name is John Strum. Thanks for listening, and we'll catch you next time.